Oh, it says that only the host can record.
Oh,
So, all
okay.
right, cool. Well, Kylie, do you want to start off or shall I start off?
Um, I can start. So, uh, for those of you who joined the High Med Journal Clubs last year, it happened every month, and there was a presentation on some form of either integrative therapy or herbal medicine or just a topic around complementary and alternative medicine. And this year, Gautam, our very own Gautam, he's just so knowledgeable in the evidence behind lifestyle medicine and he just has such a passion for cultivating the research and really being able to translate it so that we can use it and apply it and fill those gaps in our medical training that we don't or that we have. And so in in partnership with UCSD and Bastyr, we're going to be doing this new seminar series, and it's a refreshed version of the journal club that we did last year, where we won't just be focusing on one specific journal article every seminar series, but rather a collection of articles that help give you more of an idea of the breadth of topics and evidence out there that supports lifestyle medicine and integrative therapies, so that you feel like you're a little bit more armed going into practice. And I'll let Gautam give an introduction of himself, and as well as any areas that you felt like I missed when I was introducing the seminar series.
No, that was perfect. Yeah, so for everyone who hasn't met me, my name is Gautam. I'm a second year med student here. And yeah, so today we're going to be talking primarily about lifestyle medicine. And I'm going to show you guys like a bunch of papers and stuff. Let me share my slides. Can we all see that? Cool. And so feel free to shoot me an email afterwards if you have any questions, or you can pop it in the chat and Kylie will take a look at it. We'll try and take a break in the middle of this if this starts running really long, but we will make the slides available at the end of the presentation. We'll also make the video recording available. So don't feel like you need to take notes and stuff. So as Kylie said, the reason I wanted to make this presentation is primarily because there's a lot of tools that we don't have when it comes to lifestyle medicine. Some of us don't even know what lifestyle medicine means. And so we're going to go through all of that. The purpose of this presentation is to give you those tools so that you feel a little more comfortable speaking to your patients about it, and so that you have that cognition of what is the best thing we can do for our patients in every situation. Okay. And so I do have to make the disclosure immediately that I do enjoy cooking. And I have a bunch of acknowledgements here. These are people who have taught me, who have provided a lot of the data on these slides, and some people who have just been supporting me and inspirations in general. So thank you to all these people. Okay, so these are the four things that we're going to go through. First, definition of lifestyle medicine. Second, why is it important? Third, where is the evidence? So I'm going to show you guys a bunch of data, a bunch of numbers. This is kind of a little bit of an extrapolation from a journal club where we'll do a little data analysis, but it's more so to give you guys a larger framework. And then finally, what can we do? And specifically, what can you do? Because at the end of the day, that's what's most important, is what is the impact that you are going to have? So if you ever get lost, go up to the top left corner of the screen. You can see that little table of content. So starting off with the definition, what is lifestyle medicine? Lifestyle medicine is the branch of medicine dealing with research, prevention, and treatment of disorders caused by lifestyle factors, such as nutrition, physical inactivity, and chronic stress. So from the American College of Lifestyle Medicine, they have this little schematic, and you can see that incorporated in this is things like sleep, eating, physical activity, basically everything that you can think about that is not really pharmacological therapies. Another broader definition than lifestyle medicine would be integrated medicine, which also integrates complementary and alternative therapies, such as herbal remedies, Ayurveda, acupuncture, etc. Okay, so this is the definition of lifestyle medicine, like eating, physical activities, sleep, etc. And so that was the first part of the presentation. Hopefully that made sense to you. Moving on to the second part. Why is it important? So there are two studies we're going to be looking at here. This first study, published in JAMA, Healthy Living is the Best Revenge. Okay, and this is an enormous study that was published, I believe, in 2009. And it was a study of 23,000 participants aged from 35 to 65 years old. And the four lifestyle considerations that they made here are smoking, BMI, physical activity, and general diet. And if you want more specifics on what kind of diet they were following, you can take a look at the study. But overall, these are the 4 healthy lifestyle characteristics, and this will sometimes be abbreviated HLCs. On the left side here, you can see all of the different permutations of these lifestyle characteristics. So in the first line, you can see doing none of these things. And the hazard ratio on the right side, we can see has been normalized to 1. Okay, so if you do none of these things, so if you smoke, if your BMI is over 30, if you don't do enough physical activity and you don't have a healthy diet, your hazard ratio is adjusted to 1. Okay, so let's take a look at just smoking cessation. If you look at just smoking cessation, immediately your risk of chronic disease drops down to 0.67 to that 1. So it's dropped by 33%. Yeah, 33%, 1/3, just by stopping smoking. Okay, that's why for so many years we've kind of been thinking about why is stopping smoking so important. It's because the impact that stopping smoking can have on all chronic diseases, not just lung cancer, but cancer, diabetes, myocardial infarction, and stroke. And so just for a brief history of smoking, in 1950, that was when the first link between smoking and lung cancer was found. Okay. In 1954, there was a 40,000 patient study. I believe this was a physician study over 20 years that confirmed this link between smoking and lung cancer. 1954. In 1964, the US Surgeon General's report finally suggested this link. But in 1965, the AMA, the American Medical Association, the largest body of healthcare specialists in the US, withheld endorsing this report because they got a $10 million gift, $10 million in 1965 money from the tobacco industry. In 1966, this is when you first started seeing those labels on cigarette packages that say smoking could cause cancer, that sort of thing. And in the 1980s, tobacco companies started claiming contributory negligence. So this basically means, oh, well, maybe cigarettes cause lung cancer, but the people using the cigarettes should have known better, right? And then in 1998, that was when health authorities finally stopped supporting the position that of contributory negligence, that it was completely on the patients and the public side. So this is over the course of 50 years from when we first determined that there is a link between smoking and lung cancer to when we actually started changing things in terms of policy. And you can see the rates of smoking here. You can see there was a peak around the 50s and 70s in the bottom part of this chart here, and then it slowly declined. And same with the number of smokers at the top here. But why wasn't the drop even more precipitous? Like, you can imagine, like, once we know smoking causes lung cancer, everyone would just stop smoking, right? But one large part of it could have been because physicians themselves smoked cigarettes. And you can see from the number of advertisements that were available at the time, more doctors smoke Camels than any other cigarettes. The scientific effects of smoking, Chesterfields are best for you, right? There's no adverse effects on your nose and throat and sinuses, right? And this one in the bottom left, this is psychological manipulation, right? Like, if you smoke, you'll have friends, right? And this was 2006. This is the modern era. So we have all of these advertisements, and finally in 2002 in Star Wars, Elon Sleaze-Bagano said he called cigarettes, or what looks like cigarettes, death sticks. Only after the media entertainment industry started calling them death sticks did the WHO make the Framework Convention on Tobacco Control. So think about this. Over 50 years it took, right? And then 2011, 2012, there was a lawsuit against the FDA saying that these labels that we have on the cigarette packets that say that smoking can cause cancer violates those companies' free speech rights. And in 2012, it was ruled in favor of those companies as a violation of the First Amendment. So this is the modern era in which we're still battling with tobacco companies over giving this information to the public and putting that on our cigarette labels. Anyway, so that's a little bit of a tangent on smoking. So as we said, if you just have smoking cessation, 33% risk reduction in the hazard ratio compared to not doing any of these things. Let's look at if you did all of these things. And I'm guilty of not doing all of these things. I know my physical activity is not where it should be. You drop your hazard ratio down to 23%. That's a 77 to 78% decrease in getting all chronic diseases. So finally, the numbers from this study are you have a 78% lower risk of developing chronic disease if you do these 4 simple things, okay? And the 4 simple things are having a healthy diet, physical activity more than 3.5 hours a week, BMI under 30, and being a non-smoker. By doing these 4 things, yeah, go for it, Kylie.
We have a couple questions.
Okay, hit me.
Anna asked, is this never smoker or any smoking for the lack of smoking?
This is never smoker.
Never smoker. And then Katja said, what's the diet index?
So I'm not exactly sure what the dietary delineation was for this study. If you look it up, I'm sure they've shown it in the actual study itself. But we will talk about some characteristic diets that are studied later. And so that'll give you a better idea of what they mean by a diet index here. But yeah, diet index being greater than median is basically having a better diet than most, right? But I'm kind of just throwing that under the rug because we'll talk about healthier diets later. So finally, yeah, the numbers from this study, we talked about that. The biggest parts of the data here are decrease in diabetes by 93% and decrease in MI by 81%. So basically by following these four things, you can basically guarantee that you're not going to get diabetes. And unless you're stuck with some bad gene or something, you're reducing your chance of getting an MI too. Okay, so let's move on to the second study, healthy lifestyle characteristics among adults in the US in the year 2000. So this was published in 2005. Again, 4 healthy lifestyle characteristics: non-smoking, having a healthy weight, consuming more than 5 fruits and vegetables per day. And so this is a little better than that diet index that we saw in the previous one, and regular physical activity. Okay, so they were evaluating these 4 HLCs, or healthy lifestyle characteristics, from the behavioral risk factor surveillance system, which is a survey that was done in 2000. And so here are the numbers. So whenever you're looking at surveys and large like epidemiological studies like this, you're always going to have huge charts of numbers. There's not really much more interesting data other than this. So let's look at who's doing these healthy lifestyle characteristics. So total of 153,000 people here, 153,000. It's a huge study. Okay, so first looking at age. We see some relationships here right off the bat. The older people get, the more likely they are to be non-smokers. So this could be because the people who were smoking passed away and so no longer were able to participate in a study like this. Or it might be that older people are more cognizant, who knows. And then healthy weight, the younger you are, the more likely you are to be, you are to have a healthy weight. And so that's between 18.5 and 25 BMI. Let's look at education. The more educated you are, the more likely you're not to smoke, the more likely you're to have a healthy weight, the more likely you are to eat fruits and vegetables, and the more likely you are to have leisure time physical activity. So education clearly plays a very important role. So that underlines the importance of education and this correlation, but also underlines the importance of educating the people as they go through their education on all these different things. Household income, again, you see very similar trends. The more money you make, the more likely you are to follow these healthy lifestyle characteristics. So these are not just conclusions that we pull out of the blue and we say, hey, like household income and education is very important. This is a study of 153,000 people that supported that. Overall, how are we doing as a total population? In the total population of 153,000 people, how are we doing? 25%, almost, so 24% of people are smokers here. Only 40% of people have a healthy weight. Only 23% of people are eating 5 servings of fruits and vegetables per day. And only 22% of people have regular physical activity. And if we look at the combination of all 4 of those things, in terms of age, again, you see an increase over time in terms of doing these healthy lifestyle characteristics, but a maximum of only 4% of people are doing all of these things. With gender, you can see females are doing better than males in terms of doing all 4 of these. In race and ethnicity, you can see giant differences based on your race. And if you are to follow these 4 healthy lifestyle characteristics, again, education, a relationship, again, household income, a relationship. Overall, only 3% of adults in the US are following all 4. Only 3% of us are non-smokers, have a weight BMI between 18.5 and 25, are following a healthy diet, and have regular physical activity. These have the greatest impact, like we saw in the earlier study, and yet only 3% of us are doing this. And these results aren't limited to this study. This was also shown in the Nurses' Health Study, which is one of the largest, if not the largest, epidemiological study in the US, as well as the 3rd National Health and Nutrition. So this is NHANES, the National Health and Nutrition Examination Survey. So to summarize those last two studies that we saw, these are the 4 lifestyle practices. And so whenever you have a conversation with a patient about any disease, whether it be chronic or propensity for acute disease, make sure you talk about these 4 things: a healthy diet, a regular physical activity, healthy weight, and non-smoker. And it's just mentioning them is the first step. So it starts rolling around in their mind. But then counseling them on what is a healthy diet, increasing your intake of fruits and vegetables. What is physical activity? 30 minutes per day, 5 times a week, or 3.5 hours per week. And what is a healthy weight? And that's a metric that they can measure by themselves if they have a bathroom scale. So from the first study, we saw almost an 80% lower risk of all chronic disease if you follow these four factors. And in the second study, we showed that only 3% of US adults actually follow all 4. So if anyone ever asks you, why is lifestyle medicine important? It's because we can reduce the vast majority of chronic disease with lifestyle medicine, yet pretty much no one is doing it. So where's the evidence? So we looked at some numbers. We're going to blaze through some more numbers. So the state of US health, another study published in JAMA by the US Burden of Disease Collaborators. It's a multinational organization, people at the top of their field around the world, who looked at the number 1 risk factors for death and disability in the US. And you can see number 1 here is dietary risk. This comes before tobacco. This comes before hypertension. It comes before high BMI. It comes before hyperglycemia, hyperlipidemia, before air pollution, things like that. Dietary risks are the number 1 factor. So this should be at the top of our mind when we're counseling our patients: is what are they eating? Here I've highlighted in yellow all of the things related to cardiovascular disease, which is largely preventable. The majority of dietary risks contribute to cardiovascular disease, as well as hypertension, which can have secondary effects on that, et cetera, et cetera, et cetera. If we just consider cardiovascular disease as preventable, there's already such a large portion of this graph that is highlighted yellow that could be preventable. And dietary risk is coming above things like occupational risks, like accidents, things like that, that we in general consider in our mind pretty risky. So that was the primary thing I want you to get from that survey. But it's also very important to realize that healthcare professionals play a huge role in that. It's not just something that we need to put the onus on our patients for. So reducing tobacco, alcohol, drug use, et cetera, it's important for physicians to work on, also nurses, hospital systems, policymakers, and health insurance companies. And this bottom little part from the paper is talking about other systemic changes we can make. And so we know that changing our diet is important for human health, but it's also extremely important for the health of the environment. And so the food system is responsible for more than 25% of all greenhouse gas emissions. In fact, it's estimated to be about 1/3 of greenhouse gas emissions. Okay, so the food system plays such a large role. So they looked at these 3 diets. This is the healthy global diet, which is no restrictions other than restricting your red meat to 43 grams per day and having at least 5 servings of fruits and vegetables. The vegetarian diet cuts out the red meat as well as poultry, preserves the dairy, and increases the fruits and vegetables to 6 servings. And then vegan is 7 servings. All right, so you can see the differences here. So what is the impact that this has on the environment? Okay, the environmental benefits, according to this study, amounts to 500 to 600 billion if you're having a vegetarian or vegan diet, and an improvement of 200 billion if you just have that healthy diet. So that's basically just a reduction in red meat, limiting it to 43 grams per day. The healthcare benefits are monumental in terms of the effect it can have on our healthcare system. And looking at the numbers, this ranges from a $735 billion per year saving just by a reduction of red meat, and then up to $1 trillion in savings by increasing your fruit and vegetable intake. By increasing fruit and vegetables, so that would require increase in production, but because of the healthcare benefit, that we're going to save so much more money. And so how many lives are we saving through this? The main thing I want you to get from these charts are, look at how big the orange portions are. So the orange portion is the reduction in red meat. Throughout the entire world, the biggest change we can make in order to save lives is by reducing consumption of red meat. It's true in developed countries. It's true in developing countries. So we all came to medical school to help people. We all came to medical school to make an impact, to save lives, right? This is one of the main things we can do to save lives of the real patients we see on a day-to-day basis, is reducing the red meat consumption. An interesting thing that you can see here, you might have noticed, is like in South Asia, the biggest change is not a change in red meat consumption, but increase in fruit and vegetable consumption. Reason for that could be that people in South Asia don't eat red meat already. So reducing 0 to 0 is not really going to help you much. You can see a similar change in sub-Saharan Africa. Moving on to the right here, again, you see a lot of orange. This is reduction in greenhouse gas emission. Across the board, the main thing that you can do to reduce greenhouse gas emission is reduce consumption of red meat. It's monumental compared to reduction in poultry consumption, reduction in dairy consumption, et cetera. And you can see that the change in red meat reduction or greenhouse gas reduction because of red meat consumption is the same in vegetarian and vegan diets, in case you're wondering about that data. So these were the numbers in terms of greenhouse gas emissions. So up to a 70% decrease in greenhouse gas emissions for the vegan diet, and 30% decrease, which is monumental just because of that reduction in red meat. And again, I've reiterated that there. This third study, I'm not going to spend too long on it, but if you want to learn more about broad scale dietary things as well as its connection to the environment, please take a look at this study. Main thing I wanted to show here is across 5 different metrics for environmental effects. So greenhouse, not just greenhouse gases, but land use, energy use, acidification, eutrophication, red meats top the chart in terms of how much effect they have. And then next you have things like poultry, fish, and then down into our veggies. So another conclusion that they made in that study is changing consumption, so changing our diet to a healthier diet, and they made a specific healthy diet that is primarily based in plants, can avert up to 11.6 million deaths per year. So that's almost 1/4 of all deaths worldwide, just from changes in diet. This study was actually published last week, and they used those dietary guidelines in the Lancet study on the previous page. And they started talking about the actual effects we would have on the Paris Agreement. So Paris Agreement, this is if you ever get on Jeopardy or I don't know, even if you go into environmental policy, this will be kind of important for you. Making sure that we don't hit an increase in of our global temperature by 1.5 to 2 degrees Celsius. So make sure we stay under that limit. Since the global food system accounts for almost 1/3 of greenhouse gas emissions, it's extremely important. This plays a key role in keeping our global temperatures from raising that 1.5 to 2 degrees Celsius. So I know that was a little complicated. I don't think I said it very clearly, but hopefully this makes a little more sense. So at the top here, you see 50% chance of reaching that 2-degree limit. That means that we have a 50-50 chance of passing or staying under that 2 degrees Celsius increase. So if our average temperature, let's say, is 80 degrees year round, then that becoming 82 degrees, we have a 50% chance. And the 2-degree and the 1.5-degree delineation in the Paris Agreement was made because of the effects it would have on the environment, that global warming would have on the environment. So the lower we are on this chart, the less likely we are to increase in temperature, increase in average global temperatures. Okay, so lower is better. Business as usual, this is just us continuing chugging along all the way up to year 2100. And you can see that we're probably going to stay under the 2 degrees Celsius limit, but we're really like playing a risky game there. Plant-rich diet, so this was the diet that was delineated in the previous study, will already bring us closer to that 1.5 degrees Celsius limit. And here they have a bunch of other ways they envision that we can reduce our impact on global warming. If we just have a 50% transition towards all of these different things, so having our waste, increasing our efficiency, et cetera, we can already get our chances down to 67% chance we're going to stay below 1.5 degrees Celsius increase. If we were to do all of them, then the change is monumental. So this is just to reiterate that changing our diet to a more plant-based diet is one of the best things that we can do, not only for our own health, but also for the health of the environment. And these are the conclusions from that study. So to summarize everything I've said about health and environment, diet is the #1 risk factor for death and disability in the US. A healthier diet can save up to $1 trillion worldwide and 1/4 of all deaths worldwide every single year. Okay. Food system is responsible for about 1/3 of our greenhouse gas emissions, and restricting or eliminating red meat has the greatest impact, both on human health and on environmental health. All right, so let's take like a 1-minute break there. I know that was a lot of numbers, but let's take like a 1-minute break there. If you want, you can absorb this slide or like take a drink of water or something, and we'll get right back into it. Were there any other questions that came up?
Yeah, it looks like we have one. One person said, I'm a little confused about where the cost calculations are coming from, but we can talk about that at the end.
Yeah, so was it the cost calculations for the, I'm guessing for this one?
Yeah, so I'm thinking about the, I think actually the next slide.
Yeah.
Yeah, so just talking about these like these calculations, I'm a little confused how they're kind of merging healthcare costs and cost of production, since I imagine that they're different in different countries, and I'm not sure I quite understand how they've managed to understand it as like a global thing, right? Like, you know, US specific versus on an international level, how that's going on.
No, that's a fantastic question. So I think there were a couple different things they did here, and they themselves said that like the value of life benefit, for example, that you see on the right side, is not the most specific thing that they could have done. In terms of the environmental benefits and the healthcare benefits and how they've equated that to cost, I just kind of wanted to get the broad strokes across of what the effect could be. In terms of what they did specifically and how they identified based on like the heterogeneity between countries, and heterogeneity between diets and the effect that would have on costs. I'm not exactly sure. I would say it is from the proceedings of the National Academy of Sciences, so I kind of trust the source. But I would say read the paper and see what you come up with. I'm sure they've kind of described it more in detail in the paper.
Okay, awesome, thank you.
Yeah. Kylie, were there other questions?
No, that was it.
All right, cool. Okay, so let's move on. So we talked a little bit about health environment. We know that diet is the most important thing that we can change, both for human improvement of human health and improvement of health of the environment. So in terms of improving human health, are we doing what we can to keep our own health, to keep our own selves healthy? And the first question that comes to mind is, well, we have dietary guidelines. You probably remember the food pyramid from when you were a child, and now it's like a food circle. Are we at least achieving those things? And 2010 study, Americans do not meet federal dietary recommendations. Okay, so right when you read that, you know something's up. So the purpose of doing this was the National Cancer Institute made a new method of determining what sorts of foods people are eating. So they took a look at the NHANES study from 2001 to 2004, 16,000 people, and they adjusted for a bunch of different things. If you're interested in those, take a look at the paper. And this is the primary chart that they got from that. So we're talking about 16,000 people, representative of the US. What are we eating? And so most of us are probably between the ages of 19 and 30. If you're outside of that age range, I'm so sorry that I excluded you. But let's take a look at how many of us are eating below the minimum recommended amount of the My Pyramid food groups. So in males 19 to 30 years of age, almost 90% of us are not eating enough whole fruits. Over 90% of us, not enough total vegetables. Almost 99%, not enough dark leafy greens. Almost 99%, not enough orange vegetables. Almost 95%, not enough legumes. Over 99% of us, not enough whole grains. Guys, what's going on with our diet? Like most of us are not getting enough of anything that we consider healthy. You know, the only things that we're getting enough of are total grains. So that subtracting the whole grains from that, that's refined grains. We're doing okay on beans and meat and beans. Only 40% of us are deficient in that. But 90 to 99% of us are not getting enough fruits and vegetables. All right. And let's look at females. Same thing across the board. 90 to 99% not getting enough whole fruits, vegetables, legumes, and the whole grains. And now we're looking at what are we exceeding. So that was what are we not getting enough of. This is what are we exceeding. Okay. 98% of us are exceeding total fat, sugar, and alcoholic beverages. And for female, it's slightly less. And so the conclusion from that study is a little bit disheartening. We're basically way under consuming what we should be eating and way over consuming what we what we shouldn't be eating. And they made a generalization: nearly in the entire US population is under consuming fruits, vegetables, and whole grains, while over consuming fat, sugar, and alcohol. Kylie, were there questions about that study?
No. Eric
Okay,
just
cool.
made a funny comment about how, yes, he's old, and I'm in the same age category as well.
So looking at this data, this is from the Lancet study from previously, but I just want to draw your attention to how we're doing compared to the rest of the world. So North America is that little light pink. Red meat, we're having way more than the recommended amount. So they've normalized 100% of the recommended amount for each of these different things. Way more than the recommended amount of red meat. We're doubling how many starchy vegetables we should have. Eggs, poultry, total dairy. We're basically having too many animal products. And then when we look at the plant products, we're having way too few. We're not meeting our reference dietary things. So why are we under consuming fruits and vegetables? That's the big question. Why are we under consuming fruits and vegetables? It's partially because a lot of people don't have access to the fruits and vegetables. So you've probably heard of food deserts. And so that's places where there are no grocery stores or access to farmers markets, etc. Also become familiar with the term food swamp, where not only is there a lack of grocery stores and such, there's also a huge number of convenience foods available, like eating your meals from like 7-Elevens, that sort of thing. And food swamps, so access to unhealthy foods, even after controlling for food desert effects and not having enough healthy food, food swamps have a positive statistically significant effect on adult obesity rates. Also, in inner cities, grocery stores have very low profit margins, high overhead costs, and patrons who may be less able to cook and have time to cook. And so these are all considered social determinants of health. You know, we've talked about zip code a lot, but one major social determinant of health is, are you able to get the food that you need? And how is this food linked to our cardiometabolic risk? And so again, from NHANES, you guys are going to see that study numerous times here. This was serving 10,300 people. And the main outcomes are all of these things that are risk factors for cardiometabolic disease. What they saw was over 50% of the calories are from subsidized foods. And we're going to talk a little more about subsidized foods later. But a lot of these come from corn. A lot of these come from corn, soybeans, wheat, rice, sorghum, dairy, and livestock. Who's even heard of sorghum? When was the last time you ate sorghum? But the reason is because a lot of these get processed into foods, convenience foods that we eat. And a lot of these are feed for the livestock. And so the money from the government is going towards all these different things. And it's also going into raw materials for the foods we eat. More subsidized foods that you eat, the more likely you are to have a higher BMI, adiposity, inflammation, which is the C-reactive protein, non-HDL cholesterol, and poor glycemic control. So subsidized foods are essentially increasing directly your risk for cardiometabolic disease. Subsidized foods are the foods that the government is paying for. The government is using taxpayer money, right, to pay for these subsidized foods. And subsidized foods are exactly what are unhealthy for us, because a large proportion are converted into things like high-fat meat and dairy products, refined grains, and high-calorie juices and soft drinks. The historical reasons are up here, but at the end of the day, agricultural policy that says this is how much money we're going to give to certain agricultural sectors, that's what dictates production, because it's an incentive that the government is going to give you money to produce those things. Since 80% of our food is produced domestically, we have to be very conscientious of this, because we're not importing a lot of our food. The US food system, even if we wanted to, provides almost 1/4 fewer servings of fruits and vegetables than we need, which means even if everyone had access to all the fruits and vegetables that they wanted, there would not be enough to go around. We need to increase our intake by 132% of fruits and 31% of vegetables in order to meet those guidelines. So let's look at those subsidies. So this is from the Farm Subsidy Database. You can see from 1995 to 2020, the total amount paid by the government to corn subsidies was almost $120 billion. $120 billion. If you start counting up all of the different things that I spoke about before, it comes out to about $200 billion. So policy is what dictates our subsidies, which requires government spending and taxpayer money, which then down the line leads to increased healthcare costs, which will then also require more government spending. So that's kind of a vicious cycle there. And you can see where I'm coming to. So I said about $200 billion of the subsidies are going towards those things that are raw materials for unhealthy foods that I said earlier. This directly causes cardiometabolic disease. And data from the CDC shows that, from our top 10 killers, cardiovascular disease, diabetes, obesity, look at the numbers we're seeing here, $352 billion in direct and indirect healthcare spending and lost productivity because of cardiovascular disease. It's already way bigger than the $200 billion the government gave to the subsidies, right? And this is not even considering the other preventable conditions, it's just considering the cardiometabolic ones. And so if we add these numbers up, again, this is very crude like envelope math, but $1.4 trillion is spent on just these diseases. This is just from the top 10 causes. This is not talking about any of the other preventable ones. And 1.7 million lives could be saved. 1.7 million. The total number of lives lost in the US is something like 2.8 to 3 million. This is over half of those lives could be saved. And what is our healthcare cost annually? $3.5 trillion. So you can see that saving lives on this level is on the order of our healthcare costs. Another interesting piece of information, how much money do you think we spend on defense every year? It's like $600 billion. The cardiometabolic factors here, the cardiometabolic diseases, accounts for more than our defense spending. We spend more money trying to defend our borders than defending the things on our insides. So this all comes from, or this all originates from policy, essentially. And one big issue there is the USDA plays an important role both in policy as well as the dietary guidelines. So one of the USDA's roles is to promote the agricultural industry, but it's also to give dietary advice. And so you can see how there's a little bit of conflict of interest there, because what we're producing right now is not necessarily what is most healthy for us. And advertising plays another role in this. So since we live in a capitalistic society, food companies can spend as much or as little money advertising on whatever they want. Less than 0.5% of food companies' marketing dollars is spent on fruits and vegetables. Most things are spent on things that we will inherently like. Like, when was the last time you saw like an almond advertisement? I remember in high school I used to see like pistachio advertisements. Aside from that, it was mostly just like McDonald's and Happy Meals and things like that, which honestly, I really like Happy Meal toys. There's like 100 in the back over there. And so let's talk about these ads. 98% of television ads seen by children and 89% of those seen by adolescents are foods that are essentially unhealthy, high in fats, sugar, and or sodium. So it could be all three of those. And these all have the propensity to adversely affect their health. There's also targeted advertising towards certain races, certain neighborhoods, certain states, certain religions, in order to make them more susceptible to buying certain things, because they know that there's already an increased basal susceptibility. So to summarize all of that, we are basically not eating enough fruits and vegetables, and we're eating way too much fat, sugar, and alcohol. A large part of this is because either we don't have access or we have too much access to unhealthy foods. Our policy is dictating subsidies that is putting more money into the raw materials for these unhealthy foods. And since over half of our calories are from subsidized foods, like imagine how many things have like high fructose corn syrup, the consumption of these unhealthy subsidized foods directly correlates with adverse cardiometabolic factors. And this directly relates to things like cardiovascular disease, diabetes, etc. Kylie, were there any questions before we move on to the last part?
No, just some nice commentary relating to Katja's question about cost, but we can go through that later.
Cool. All right, last portion. So what can we do? This is just kind of a list that I came up with off the top of my head of things that if you're really interested, I more than highly recommend you go into doing this kind of stuff. So writing legislation. So I've talked a lot about legislation. You guys are like, oh, I'm in med school and this guy is again going into humanities. Why did I come to this talk? But the crux of the issue is that these policy issues are a healthcare problem. Our healthcare system, we call it a healthcare system, but it's more of a disease care system. What we do is, instead of supporting people's health, we're coming back on the other side of it and trying to treat it once the health problems have become health problems. The first thing that we say in the Hippocratic Oath is primum non nocere, and that means first do no harm. But at the end of the day, the vast majority of what we do as physicians is fixing once the harm has been done. So if we want to first do no harm, it makes our role as a physician not only just to heal the people that come into our clinic and our hospital and things like that. It's preventing on a large scale basis from our patients becoming patients in the first place. So kind of be cognizant of that, as if you're, regardless of if you're a Bastyr or if you're at UCSD, if you're a first year, second year, third year, fourth year, keep that in mind, that if you want to do no harm and if you want to have the biggest impact on your patients, we need to make sure that they don't become patients in the first place. We need to make sure that we have these conversations about diet with them, etc. So other things that you could do if you're really passionate about this, write legislation, lobby for a health organization to be in charge of the dietary guidelines instead of an agricultural organization, restrict predatory advertising. We talked about the race and age discrepancies there. Educate our children early. There are numerous studies you can see down in the references that were done on initiatives that were done for children in 5th grade and stuff, and they extrapolated how much of a health benefit they would have if they improved school lunches, if they improved elementary education about food. And we should start creating national programs that really support healthy eating. So this could be advertising healthy foods. This could be community support groups. This could be community leadership. There was a huge study done in Finland, which is very, very popular in the field of lifestyle medicine, that showed that after they enacted things like this, so they incentivized dairy farmers to become berry farmers and that sort of thing. They were able to achieve a 65% reduction in mortality from ischemic heart disease, which was running rampant in Finland at the time. The US is undergoing a very similar pandemic to that epidemic outside of COVID, that we should really be cognizant of things like this, initiatives like this having a real effect. Okay, so those were really broad scale things. And you're like, all right, well, I'm not going to go into legislation. Screw that. I want to become a clinician. So what are the things you can do? First thing is educate yourself. So I want to thank you guys so much for coming to this talk, because this is the first step to really understanding that data. If someone says like, well, why should I exercise and stuff? Because nearly 80% of all chronic disease can be prevented by exercising and eating better. If someone says, well, I think I already do those things, only 3% of Americans are doing all of those things. Now you have that data rolling around in your head, which means that not only can you talk to patients about it, you can also be a better role model yourself. So every patient that you talk to, like, have a conversation about diet, exercise, and smoking cessation, because over time, you might not feel comfortable with it now, but over time, you will slowly understand how to counsel patients so that they listen to your dietary recommendations. At the end of the day, a lot of patients don't really have anywhere else to look than their healthcare provider, who's so important for things that so important for lifestyle things such as changing their diet and stuff. So you are going to be not only a role model, but a huge source of information. So it's very important not to brush things like diet and exercise under the rug because you think patients aren't going to do it. In reality, they might not, but giving them that information and really encouraging them has shown in studies that's an incredible thing that you can do for your patients' wellness. Another great thing that you can do is teach your peers, even teach your attendings, if they don't know much about nutrition. You can do this in your ACA. You can do this when you're a resident. You can do this all the time, okay? And again, if you're more passionate about it, you can do community outreach, etc. And so as a final kind of parting note, lifestyle medicine is not just for people who are interested in these like broad scale epidemiological or public health things. There have been studies in numerous different fields. Like if you're interested in orthopedics, there was a study showed that placebo surgeries, so going in and not actually doing like a meniscectomy or going in and not doing debridement is actually not helpful compared to just opening them up, putting them under anesthesia and closing them up. It could be because of the physical therapy that they do afterwards between those two things, right? So be cognizant of the fact that therapies, even if that may be like a knee surgery, might not be the best thing for your patient, and then here's one in neurology, and there have been so many studies done. This was published in The Lancet about Alzheimer's disease prevention, where look at all of these risk factors that are associated with Alzheimer's: diabetes, hypertension, obesity, depression, physical activity, smoking, all of these things that we can address without having to, do any sort of procedure, surgery, medication for our patients. The mechanistic explanation is below here, where you can have reduced intracranial arterial stenosis and better brain perfusion. But the impact that you can have by having these lifestyle conversations, whether you're in orthopedics or neurology, it can be enormous. So just to summarize, the main takeaways I want you guys to get from this, if you guys remember one thing at all for yourself and for your patients, remember those 4 healthy lifestyle things. I'm sure this is stuff that you've heard your entire life, but have a healthy diet, physical activity more than half an hour, 5 days a week, healthy weight, 18.5 to 25 BMI, and smoking cessation. Most of chronic disease can be prevented, but most humans in the US are not doing the things necessary. Diet is the number one risk factor. Healthier diet can save over $1 trillion annually globally and prevent 1/4 of all deaths. Food system is super important for greenhouse gas emissions, so it's not only our own health, but it's the health of our environment. Restricting and eliminating red meat is the main thing that you can do for improving your health and the health of the environment. And obviously, like restricting or reducing poultry, even better. Restricting or reducing anything but like a plant-based diet is phenomenal. But small steps is always good. We're under-consuming fruits, vegetables, whole grains, and over-consuming the subsidized things. Subsidized things are what the government is paying for and what then we pay for with our health. So make sure you talk to every patient that you see about these things. And I'm always happy to answer questions via email or come talk to me about any of this stuff, whether it be diet, lifestyle, you name it. So thank you very much.
Thank you so much, Gautam. That was amazing. I know I learned so much. I hope everyone did as well. There aren't any additional questions, although Eric did he copied and pasted the methods from that paper that Katja was asking about.
Right on. Thank you so much for that, Eric.
And if everyone who's here, I have a list of people who signed up in the HiMed Student Interest Group Fair. I have your emails and I'll be sending an email out soon. But if you didn't get a chance to sign up there, feel free to drop your email in the chat and we can send you an email and we'll keep you updated with any future talk. Gautam will be giving a series of different talks over the course of the year. And we're hoping to relate them to the MS1, MS2 block schedule. So hopefully they're relevant, especially in the immediacy and what's on your brain and what you're studying right now.
Yeah, thank you so much, Kylie. Yeah, please come by to the other talks. I promise they'll be much more focused than this one.
Do you have a podcast or something? Because I see you have a setup there.
I do actually. It's called Everything Considered. You can look it up on like Spotify and stuff.
Pretty good.
Cool, thank you.
Samana has listened to all of them.
This is not like a technical question. This is just something I've kind of struggled with. So before this, I was working in food education. Mm-hmm. I was working in the world of like food justice, food policy, and kind of something that I'm not totally sure how to think about this, is that I don't know how I feel about governmental interventions on lifestyle. Right. So for example, I'm from New York City, and a good example of that would be the New York State soda ban.
Yeah.
Right, which is aimed at, you can't sell, it was some like gargantuan magnum size, like they're not allowed to sell those anymore at movie theaters. And there was this big backlash against it. And I guess on the one hand, I'm understanding the intent behind it. On the other hand, I feel weird about governmental interventions that feel kind of on the line there. And I'm kind of curious what your thoughts are.
So in what sense do you feel on the line about that? Do you feel like the government is like doing too much and they're kind of encroaching on our space?
Yeah, so I wonder at what point it's like this paternalistic thing. At what point is it like we will refuse to produce meat? And not even saying that that's necessarily a bad decision, but just kind of wondering whether it's a slippery slope. If it is, like at like, just where do you draw the line?
Yeah, no, that's a really good thought. I think in the ideal world, if everyone had all of the knowledge and they were able to make an educated decision for every decision they made, then the government could do whatever it wanted and we would still make decisions that are best for ourselves, whether that be, reducing our soda consumption or red meat consumption, whatever that may be. I think the higher level that the government is, the more likely it feels like their regulations are encroachment on our lifestyle, and so like the federal government doing something like this, it probably seems much more intense than the state government like making a certain guideline. For example, like improving school lunches, like not making Red Bull available in school lunches. That seems like a no-brainer to us. And we don't have Red Bull in our school lunches, but we also can't, we don't have cigarette marketing in schools, right? And we can all agree that's a good thing. But so again, it comes to where do we draw the line? I think this is a much more philosophical thing, but if you've read what's his face, like the Social Contract and things like that.
Oh, Hobbes? Are you throwing all the way back to Hobbes?
almost. If we're talking about like even like Machiavellian like how does a society function and that sort of thing, the reason we've created society is to benefit all of the people within it, right? And so a government is supposed. Sorry, say that again.
Rousseau, right? The social contract is Rousseau.
Rousseau. Yep. Like the purpose of a government, right? The reason humans originally came from like, tree dwellers into societies is in order to benefit all of the people within that society. And the government is supposed to represent and help the people that it serves. And so to a certain point, we should be formulating our government in order to achieve what we feel like are our needs, and so if the majority of people decide like, hey, we should just not be advertising cigarettes to little children, then it is the government's responsibility, their total responsibility, to provide that for their citizens, because the government is representing those citizens. I think the issue that we're running into here with the gray area is that there's such a large heterogeneity in terms of the things that we can believe on so many different spectra, whether that be like on the soda tax or whether that be on subsidies, that one decision is never going to satisfy all the people, right? And the fewer people that it satisfies, or the more subgroups of people there are, the less likely that we're to believe that the government has a right to go and do those things. I mean, I think if we look at other countries, like, like Mexico has a soda tax. I believe there are other countries in South America that have a soda tax, and it's worked well in terms of improving their health outcomes. But at the end of the day, do those citizens feel like their space is being a little encroached upon? Do they feel like them having to spend more for something that they enjoy, and then that money going to the government, and then the government getting to do whatever it wants with it? Is that not something that should be done? I don't know. To be honest, I don't know. I think I have very strong opinions on what I would want, but that doesn't answer what is correct.
Yeah.
And to kind of add on to that, one thing that I've noticed that's happening, especially in the San Diego area, they're incentivizing the purchasing of fresh fruits and vegetables as opposed to imposing restrictions on unhealthy food products. And so it's, that might be a way to get around this feeling like the government's encroaching. Just a thought.
Yeah, I think that's also really important on a one-to-one basis when you're counseling patients and such, because if you tell a patient to reduce consumption of something, that's much harder to do when they have an inclination to eat those things. If you tell them to increase consumption of other things like fruits and vegetables, that will automatically displace calories on their plate. And so if you can only eat 2,400 calories a day without feeling like you're a fatty, then if you replace 400 calories of pure fat with 400 calories of broccoli or something, we didn't even have to say reduce your fat. All we had to say was increase your broccoli consumption, and then you got those two birds with one stone.
I do think it's a really good question, though. It's a complex issue, especially given Gautam, what you were saying about the polarization and complexity of opinions in this country. But also, this is kind of my pet issue, as some of you all know, but like drug policy, for example, is tied into health policy. And I think drug policy ostensibly, which has aimed to protect the health of people, has in many ways done the opposite. So there's some examples, I think, of like the drug war that kind of erode faith in government. So I think that we can, but at the same time, if we have good data like you're presenting, maybe we can make more reasonable decisions.
A yay for Oregon, right, Eric?
What's that?
It's a yay for Oregon for legal.
Oh yeah, absolutely, right on.
Yeah, I have I feel I have a lot of mixed feelings on this. I think particularly after working in the food justice space, which, yeah, you know, um, I think there's I I like the overall conclusion of kind of like eat less red meat. Like I'm into that, and I'm into the idea of reducing subsidies for these current things. I think when it comes to like I think we focus so much on the health that we forget the intersectionality of agriculture and human rights within that area, right? Because,
Mhm.
like for example, there was like a boom in quinoa, in like quinoa interest in the United States, it like displaced a lot of the native diet for the areas that were actually producing quinoa. So you
Mhm.
get all these like weird ripple effects, and it kind of feels like you can't really do anything. Like it's frustrating, and so I do wonder what the overall impacts would be of worldwide transitioning to a more plant-based diet, because there's going to be all these effects that we can't predict.
Mhm.
Which isn't to say that we should do nothing, obviously, but it is something that plagues me.
Yeah. I think making those like small iterative changes towards whatever it may be, like I mean quinoa is pretty nutritive, so the whole world eating more quinoa would probably be a good thing. But how I like to think about it is there's always going to be some issue when we make such a large scale change. And so, like for example, when we went from yellow cab taxis to Ubers, right? What happened to the yellow cab taxi drivers? Did they die out as a species? Well, some of them lost their jobs. A lot of them probably lost their jobs. A lot of them transitioned over to Uber. And so it's kind of the same thing. Like even in the US, we see farmers, for example, who are in the dairy industry. And when there's been like an uptick in how many non-dairy products, like non-dairy milks and stuff that consumers want, like a lot of them are getting less money. I mean, they still get their government subsidies, but they get uh, uh, less sales, right? A lot of them have started switching over to non-dairy things because it doesn't really matter to them if they're milking cows or milking almonds, right? At the end of the day, they need to make a livelihood, and so the transition will happen. Unfortunately, for people who are resistant to that change with anything, it's going to hurt them a little more. But I think that there are ways to make that solution happen. I mean, there's one great quote that my nutrition professor from undergrad, Dr. Crawford, told me about Voltaire. It was like, "Don't let don't let the perfect be the enemy of the good," or something like that. One of
Yeah,
my favorite quotes because I was like super disillusioned back then. But I
yeah,
think I think we'll
absolutely.
slowly get there.
Yeah, I think the point about Finland kind of subsidizing and pushing move to like dairy farming or whatever it was, I think
Mhm.
that that's a great way to go about it, like pushing meat farmers in